So I'm aware this video is being recorded. It's going to look very odd. We've had a couple of interruptions, so I'm just going to say my name's Fawn Harrad-Hyde. I'm really pleased to be here, which I've already been through, so I'm not going to do again. I was just starting to tell a sort of the story of my career trajectory to date. And the sort of the straightforward way of that I often tell this story is that after I did my undergraduate degree, I started working in both research roles, so on a research internship at University of Leicester. And I also started working in care roles, so as a support worker for adults with learning disabilities at the time. And now I've tried to find ways to combine those interests. So I'm conducting research into care home settings and into caring. I also have some personal experience of being a family carer. So I cared for my nan. She had dementia for the last 3 or 4 years of her life, and she spent the last 12 months in a care home. And I'm currently navigating being a new mum. So that's the latest bit of care that I'm doing personally. I did say earlier I've taken this off an organisational slide set, but I do work at University of Leicester. I used to be part of ENRICH, which stands for Enabling Research in Care Homes, which is an NIHR, part of the NIHR that sort of facilitates care home research, but that is changing at the moment. And I'm also affiliated with LOROS, which is the hospice in Leicester, as part of their Centre for Excellence that does all the research and education work. I think one of the reasons that I've been invited to talk today is Faith described my career as interesting when she said, I think your career would be interesting and people would want to hear about it. And I think probably what she means by that is it's not as linear as it sounds here. So that sounds quite a straightforward story, like I worked in research and care and now I'm doing research and care. But in reality, it's been a lot more scattered than that. And I thought, well, how do I, it's actually often quite difficult to sort of share a sensible career trajectory story. So what I did, thought what better way to do that for a bunch of researchers than to put some of my work experience in a Gantt chart, which is a strange thing to do when you're putting your own life in a Gantt chart. But the reason I did this is I wanted to show that often I've done sort of multiple things at once. So often sort of done in the early days doing like research work and care work. In that middle section there, when I was doing my PhD, I was doing the ENRICH work also. I finished my PhD and was working with LOROS, but still working, doing sort of supporting other people's research studies. And it wasn't until sort of 2025 that I went full time at the university. And I actually just finished my post with LOROS and started a new post in the psychology department, which is on a Wellcome Trust funded project around supporting family carers of people with Huntington's. So yeah, not as straightforward as it always seems. And because of this, I often say this is sort of less of a career ladder as such, not a straightforward ladder. I see it more like a patchwork quilt. So you go around and you collect all your squares, some of them out of necessity because you have had to learn a skill or a theory or a particular topic in your job, but some of them just out of interest because you found something really interesting. But what you end up with is something that's sort of stitched together and it's uniquely yours, but it's also still a work in progress. So I like that analogy better than a ladder. It seems to work better for me and may work better for you and people that do lots of bits of research work. I also wanted, though, although it looks quite scattered in some ways, there are some key themes. So what better way for qualitative people amongst us than to really think about what are some of the themes that are between those jobs that I've done. And I've thought about 4 themes. So predominantly I use qualitative methods, so things like focus groups and interviews, but I've got some experience doing ethnographic research, which I really enjoy and find fascinating. A lot of the research that I do sort of centres around people's experiences of caring for others. So that might be formal sort of paid carers like care home staff or informal family carers. And I'm particularly interested in how we make decisions about somebody's care. A lot of my work is focused around doing research in care home settings. I find care homes absolutely fascinating, not least because they're all very different. Like they're all different in terms of you get some sort of standalone care homes and some great big organisations that are part of big chains, and the staff are different in each of them, the premises are different, the residents are different. So they're really interesting settings. And I'm also quite interested in how sociological theories might be applied to real world problems that occur in care home settings. And I couldn't find an appropriate image for that. So this is real footage of me thinking about a sociological problem there. So yes, so that's sort of what I'm interested in. And I also wanted to tell you a little bit about the studies that I'd led to date. And there's sort of three main studies that I'll just talk about very briefly. So the first one was my PhD study, and in that study I was asking, how do care home staff make decisions when care home residents experience deteriorations in their health? And in order to answer that question, I interviewed 30 members of care home staff across 6 care homes. And then I went back into 3 of the care homes to do some observation work and to do some ethnographic field work. And sort of the key findings that came out of this study was to really show how complex those decisions should be about, okay, this resident doesn't look right. What should I do? Can I manage that? If I can't manage that, who should I escalate that to the point where care home staff are then thinking, if I escalate this outside of the care home, should it be to a GP or to 999? Often staff often feel that they're balancing multiple risks. So risks for the resident in terms of, it's hard to get the appropriate healthcare in the care home, but I know that sending them to hospital can be risky in itself because they might pick up infections and spend time in bed. The risks for themselves as decision makers about wanting to be covered and able to justify and live with their inactions and choices. Risks for wider healthcare services, for their relationships with people in the care homes. They're much more complicated decisions than we might first assume. And then as a follow-on study, I was lucky to be awarded a Mildred Blackster Fellowship, which is from the Foundation for the Sociology of Health and Illness. And as part of that fellowship, I was able to conduct a follow-on study about the experiences of ambulance staff when they go into care homes. That was only interviews with that study, but I managed to talk to 22 members of staff across 7 different ambulance trusts and ask them, how do you make a decision about what to do when you turn up in a care home? What's your experience like of making decisions? And again, I think ambulance staff similarly do have to weigh up those different risks. They're also aware of risks to themselves as professionals. They don't know the care home residents as well as the staff do, so they are relying on the care home staff in some ways. But I actually think this is a really interesting topic because you've got sort of social care staff looking at things in one way and trying to work within their policies, and then healthcare staff looking at it in another way and trying to work within their policies. And then you've also got residents involved in there who may or may not be able to contribute to decision making, and relatives who may or may want to be involved and may or may not have legal powers to be involved. So they're really interesting scenarios. The third study that I wanted to tell you about briefly was it wasn't a follow-on study as such, but it was a sort of a related study that I was running with LOROS. And in this study, we wanted to know more about whether we could, other things that we could do to help family members prepare to be involved in some of those discussions. And in that study, we interviewed 29 family members of people who lived in a care home and a further 11 members of care home staff. And they talked to us about all the difficulties they'd faced in terms of perhaps not understanding their loved one's health condition and how person's needs might change, and how often that they felt like they were firefighting, and that made it really difficult to plan forwards. Alongside this, I've got a sort of personal experience of these types of decisions. I talked about my nan earlier. This is a photo of my nan. Her name was Anne Wild-Smith. She'd be, if she was still alive, she'd be super excited to be involved in the presentation. This would be her showing off. But she spent the last 12 months of her life in a care home, and when her health deteriorated quite quickly, we were asked this question about, would you prefer her to be sent to hospital or not? Now, it was in the pandemic, so we decided against that, and ultimately she died in a care home, and I think that was the right choice. But I think having a personal experience does add an extra layer on, because I always talk about weighing up different risks, but having been through this experience myself sort of reinforced how weighty those decisions could be and how they can really sit with people for quite a long time. So they're the studies that I've been involved in. I do a few other things. So particularly in the last 12 months or so, I've become more involved in the BSG as an organisation in itself. So I'm part of the Care Homes Research Special Interest Group and part of their committee. And I've just joined the BSG Executive Committee. And if there are other people on the call who are perhaps come to some of these events but would like to be more involved in the organisation, then I would really recommend it. And I know that our president, Professor Martin Hyde, is really keen to hear from early career researchers about what do you want from the organisation and what would you'd like to see more of. I've been part of some other groups, so things like the 999 Emergency Medical Services Research Forum, which is all around sort of pre-hospital and ambulance related research. I'm a visiting fellow at University of Bath's Centre for Deaf and Society and a member of the Ethics and Ethnography Observatory, which is a group of researchers who all do health and social care research using ethnographic methods. And the reason I tell you this is really to flag how useful I've found these activities. So to be involved in other groups and to get to know people, they're really good networking opportunities. And then I also take part in just some other sort of collegiate activities, such as peer reviewing people's articles. I'm a PhD supervisor to 2 PhD students, and I really do enjoy informally supporting other PhD students, for example, by just talking to them about what are your key findings and what are your key messages, and checking in with people throughout their study, and doing like mock vivas for people within the University of Leicester as well. And again, they're all things that I found to be really good learning experiences, and hopefully there'll be some good karma as well when you give nice things out to the world, but who knows. But I just wanted also to sort of present something that's sort of beyond just the highlight reel of when things go right. So just last week, I had an application for an NIHR postdoctoral fellowship rejected, and it was unsuccessful. So it got all the way through to interview stage, and I had the interview in the back end of January. And I was really excited about this study. So it was sort of followed on from the 3 studies that I talked earlier about. And what I wanted to do was, instead of talking to people about their experiences of making those decisions, I wanted to try to actually see how those interactions and decisions are made in practice. So I wanted to follow ambulance staff into care homes and to use ethnographic and conversation analytic methods to observe, record, and analyse how those interactions unfold in real time. And some of that would involve me being present, and some of it would involve recording discussions as they go on. So there are lots of issues around ethics, but I don't think they're impossible. But as I said, this wasn't funded. And but I'll see what the feedback says, and that'll help me decide whether to go again. The fact it got to interview, I think, is really promising. And the reason that I wanted to talk about this in this event is because I think sort of failure, which I do put the quotes around, is really common in academia, and that's okay. And I think what helped to soften the blow for me this time last week was that 2 colleagues in the weeks before, the sort of week or so before I found out, 2 colleagues had grants rejected or fellowships rejected, and were really upfront about this. And that helped me to go, okay, it's not just me, like this is quite a common thing. So I thought it might be helpful to share that with people today, in case you're in a similar situation right now or in the future. Like, it's okay, and it's not as personal as it might feel right at the beginning when you first read that rejection email. And the same goes for papers as well. And we were talking about papers earlier on in this call. So I'm going to sip my beer now. So apologies, I've got a sore throat. So I've got three further slides before I just get onto my final thank you slide. And I was really thinking about what advice might we give to other people. And I particularly was thinking about, I've got advice for people who are specifically thinking about working with care homes. And the first of that is to recognise that care homes are sort of first and foremost somebody's home. So you're a guest in somebody's home, but they're also somebody's workplace, and you're a guest in that workplace. And sort of a linked point to that is then a lot of care home research I have found, whether that's recruiting to my own studies or to other people's studies, really does require you to build good relationships. And that sounds like straightforward advice, but what do I sort of really mean by that? You know, like any other sort of friendship relationship, they're all about that sort of give and take, and you're asking things of people's time and of their energy. So what can you do to make it as sort of least burdensome as possible? Other things that you can offer care home settings, like sharing links to training or webinars that you think might be of interest to them, making sure that you respect any policies that they have in place and try your best to work around them and not ask too much of them at once. or asking them if there are days and times that might work better for them. So care homes don't usually want you in on a Monday when the manager's trying to catch up with everything that's gone on at the weekend. We always find they suggest 10 and 2 because you've not got meal times in that time. But, you know, it's trying to really work out what works for that other person. I think it's also, especially for me, having had experience of working in care settings and then being a family carer, it's really key that we're practicing reflexivity. So do you have any pre-existing experiences of going into care homes? Do you know what to expect? Sometimes it might, and some of that is about being appropriate in a care home setting, but some of that is about protecting yourself as well. Like you might see people who are very poorly and that can be upsetting. What will you do with that? Do you have a support within your organisation? Are there things that you can do to keep yourself well if that happens? And have you got any sort of like preconceptions of care and what good care looks like and what bad care looks like, or about the care home sector? And if you know very little about the care home sector at the start of your PhD, that's okay. Like there are lots of organisations you can go to and reports that you can read to try to get a feel for it. Another thing is that if you're doing research in care homes, there is lots of guidance around common issues that occur. So, for example, if you're concerned about trying to involve people who lack capacity, there's the NIHR Include guidance, which is very much around trials, but a lot of that will apply to other types of research. The NIHR DEMCOM Fellows, which is sort of a group of people who got together to think about dementia research, produced a dementia research ethics resource, and they talk about all different stages of the research process, from like identifying your participants to consent to sort of data collection and analysis and PPI. It's a really great resource. And there are lots of organisations that can support you also. So the NIHR Regional Research Delivery Networks. We have our care home special interest group at the BSG, which is a really fantastic group. There are things like the Margaret Butterworth Care Home Forum, where people come and present their care home research, and organisations like Skills for Care. Like wherever you are, there should be a local Skills for Care person. Second slide was just sort of general advice for PhD students. So my PhD finished in 2021, so it's been a few years now, but not so far away where I've forgotten all about it. And the first thing I just wanted to put right at the top was I think we need to make a collective effort to try and put our imposter syndrome in the bin. This is something I hear all the time, like from new PhD students right through to colleagues who have much more established careers than I do. I think we all feel a little bit like, oh, am I a good fit for academia at times? But I think if we all feel like that, then surely it can't be true. So just please try your best to just, put that in the bin if you can. I'm also a really big believer in taking breaks. That's not means that I'm somebody who shirks their work, but have been described as an enabler by other PhD students. Because usually someone will say, I'm so tired. I say, just take a break. Because I know personally I can't do my best work when I feel overwhelmed and really tired. And I think this is something that I've not been very good at carrying through to postdoc life, but during my PhD, I was quite good at taking breaks and going for a swim or going for a walk. And it's something that I'd really like to pick back up now because I think it's useful. As a PhD student, I also found it really helpful to try and build in time for planning right at the start of the week and then like reflecting right at the end of the week and blocking out the first and last hour of the week, for example. And it sounds really silly and really simple, but I think that made a massive difference for me in terms of like helping me stay on track and to think about what have I already done and what's left to do and how am I going to do that and in what time. And I'd really, really encourage you to reach out to others who've got similar interests. And I'm always so pleasantly surprised when I reach out to other people, other researchers, other academics that sort of have similar interests, that people are always willing to talk or willing to help. And I'd say on the back of not having my NIHR fellowship awarded, I did say people often say academia is like full of sharp elbows, but that's just not my experience at all. I always find people are really kind and generous with their time, and especially if you've got a shared interest, people love talking about their research and thinking about how it fits with other topics. And then just as my sort of penultimate slide, I was thinking about advice for sort of people who are post-PhD or early career researchers like myself. It's a little bit harder to give advice here because I feel like I'm only a couple of years into this phase myself. But I did hope that patchwork quilt analogy might be useful to some people and that it's okay if you don't feel like you're necessarily climbing a ladder and that you take a side step. So technically, the post that I've just taken, where I'm running a project about well-being of family carers of people with Huntington's, that's not climbing a ladder. It's the same sort of grade post as the post I had originally. But I think I'm going to learn lots of new skills and sort of learn about new topics and pick new methods skills up along the way. So I think that that's okay. And it's usually whenever I take a sidestep that something special happens. So I'm quite excited. Just prepare yourself for sort of failure or rejection. It's actually not failure or rejection. It's just part of the process, I think. And unfortunately, it is one of the parts of academia. And I would really say, even when you're post-PhD, I'd really recommend people to continue to network and to get involved in groups and organisations and societies like the BSG, because, again, you just get to meet lots of nice people, which is nice in itself, but it's nice for a research perspective when you get to learn about other people's research topics and research methods and all the studies that are going on that otherwise you might not hear if you're just working with people in your own organisation. So that's me. I've delivered that probably a bit quick with everything that's gone on, but just to say thank you and a cheers. I did bring my my Everard's beer. Everard's actually funded my MPhil project. It was they wanted a different way of looking at their pubs, so we got to spend lots of time interviewing people and doing like ethnographic work in pubs, which was fun. But I did choose to come back to care homes and carers because that's where my passion lies. But I'm going to stop sharing so that I can see you, because I can't see anybody at the moment. And I'm happy to take questions, or we can just have a chat, which would be lovely.